Hey guys, and welcome back to the Science of Exercise. I'm Tyler. Today I'm joined by Dr. James Reed. He's a physician in the area around here in the Lakewood Ranch, Florida. You give a quick just a little bio, nothing too crazy about yourself.
Yeah, thanks for the introduction, Tyler. Yeah, I'm Dr. James Reed, family medicine physician. I did my residency at Greenville, South Carolina. I focus on family medicine. A lot of it's identification and treatment of, just general diseases in the population. As a family medicine doc, the reason I'm here with Tyler is a lot of what we do is focusing on not just treating the disease, but finding the root of the disease and making some lifestyle modifications to help get our patients healthier, feeling better, living life better. So
Today we are going to be talking about BMI specifically. Without further ado, we'll just kind of get right into it. So Jimmy, what is BMI? What does the term literally mean? And then what does it necessarily mean for you in clinical practice?
So BMI is a body mass index, and it's basically, it's the ratio of your body weight to your body surface area. So,
Sure.
Basically think, you're a certain size, what do you have packed into that surface area? So,
Sure.
Yeah.
Sure.
It can be muscle, it can be fat, it can be other things, but it's the ratio of your weight to your body surface area.
Perfect. So clinically, how do you use BMI?
I basically think of it as another vital sign. So
Sure, yeah.
When someone comes in my clinic, what do? We check their blood pressure, we check their pulse, we check their pulse oxygen,
Right.
we check their height, and we check their weight.
That makes sense.
And with your height and your weight, with the calculation, you get BMI.
Right.
So it's basically, think of it as another vital sign. I mean, you have to take it within context, but if you look at it, it can give you some pretty good insight into aspects of a person's health.
Absolutely. So for those of you looking to calculate BMI and don't know how to do it, basically I'm going to hit the pause button right here, and I'm going to put it up in the top corner for you guys so you guys can calculate it. So clinically, we just talked about how you use it, but what do you normally see? Like if somebody comes in and their BMIs, we'll say even generally over 25 is kind of like what we speak of is kind of, you start to look into that's overweight, but 30 plus is really kind of
30 plus is when it's time for an
Yeah.
intervention.
Yeah.
Let me just use an analogy. If somebody's blood pressure is 130 over 80, it's not time to get put on medicines, but it's time to start talking about, hey, what lifestyle changes do we make to get that back down to a healthier level?
Right.
With BMI, I think of it the same way.
Sure.
If somebody's 28, you can kind of say, hey, you're carrying extra few pounds there. We can talk about changing your diet. We can talk about changing your exercise routine.
Sure.
Change what you're eating, change what you're drinking. You'd be surprised. It's just some simple things you can approach that can bring somebody's BMI back down to a healthy level.
Right.
Why do you want the BMI at a healthy level? Well, that's an interesting topic. Diabetes, hypertension or high blood pressure, dyslipidemia or high cholesterol.
Yeah.
Those are all, basically health risk factors that are associated with a high BMI. So you get that BMI over 30, that's when you really start seeing type 2 diabetes. It's really when you start seeing high blood pressure.
Sure.
All of these things that we talked about are going to put you at a higher risk of a stroke, a higher risk of a heart attack.
Right.
So, in general, you get the BMI down, you can kind of take care of a lot of the health problems that go along with carrying that extra body fat.
So clinically, Jimmy, what I'm hearing is basically we're looking at an exercise intervention along with a diet intervention. But these exercise interventions don't have to necessarily be these intense training protocols, right? So potentially I'm hearing if somebody's got arthritis, they're a little bit overweight, maybe they're just going for a walk or they're swimming, right? They're trying to get a little bit of decrease on that weight bearing on the joints potentially, so that way they can expend some extra calories. And then they can actually take in a little less calories through the diet and nutrition. So
there's plenty of things you can do, and it's like, as a family medicine doctor, I'm taking care of patients between the ages of 15 days and 95 years old.
Sure.
I've had, everybody doesn't need to get on an Ironman training program.
Right.
Say you have somebody that's got advanced arthritis in their knees, well, an elliptical machine might be good for
there you go.
30 minutes for 3-4 times a week.
Sure.
Water aerobics.
Sure.
It doesn't take this huge overhaul of somebody's lifestyle. It's, you can burn 100 calories here and 100 calories there.
Right.
You might find somebody drinks half gallon of sweet iced tea a day. You cut that out.
Yeah.
You'll see miracles after 6 months.
Yeah. You think about it from the standpoint of even Coke to a Diet Coke, right? That's potentially 100 plus calories right there in itself.
I mean, the Diet Coke has its own set of problems too.
Sure,
But
it could be a start, right?
think of it this way:
It's a process.
a pound of fat is approximately 3,500 calories.
Sure.
You know, so say if you increase your exercise 100 calories that you're going to burn a day. Say if you decrease your sugar intake by, you know, another 150, 200 calories, then you're going to be at that 3,500 calories in no time.
Sure.
You know, over the months, pounds are going to shred off.
Sure.
You're going to look better. You're going to feel better. You're going to be at a lot lower risk for different disease states. So.
And notice how Jimmy spoke specifically on saying with exercise. So what happens is when you decrease your calories you go in a caloric deficit, you start to have this what we call thermogenesis effect. And after time, we have this thing called a resting metabolic rate, and that thing kind of starts to plateau as you eat in a caloric deficit. So you actually, Jimmy mentioned exercise. What does exercise do? It increases physical activity, thermogenesis. So then we start to have this increase in basically how we burn those calories. So if you continue to just eat in that caloric deficit, over time, you actually have to continue to drop those calories, right? You can't eat at minus 500 this week because as you drop that body weight, you have to further then drop it again, right? So something that you want to include with these diet interventions is always exercise because it keeps that caloric expenditure
It keeps
higher.
the furnace burning, basically.
Keeps the furnace burning, exactly. So in summary, BMI, give us a quick 10-second, 15-second look at what is it, how do we use it?
BMI, you take it in context. I basically use it as a vital sign, as I said.
Yep.
You know, looking at that along with somebody else's, you know, whole picture, it's going to tell you what they're at risk for.
Sure.
You know, like I said, it's, you know, with a high BMI, you're at risk for diabetes, you know, high blood pressure, stroke, heart attack. You get that down, you're going to increase somebody's overall health. You're going to make them feel better.
All right, well, I appreciate Jimmy, or Dr. James Reed, being on the show with us, or on the channel, I should say. And he's going to hopefully be a part of this channel moving forward, really helping shed some light from the clinical side of things, not necessarily just this exercise population as well. So this is kind of, now we're taking this really broad approach with the science of exercise. So I really appreciate him being on, shedding light on these topics for us.
Thanks for having me.
Absolutely.
If you enjoyed this video, make sure to subscribe and like.